The American Academy of Otolaryngology, Head and Neck Surgery, is the world's largest organization, representing more than 12,000 specialists who treat the ear, nose, throat, and related structures of the head and neck. While the Academy is a member organization that focuses on member services for the practice of medicine, the AAOHNS Foundation is a public trust and works to advance the art, science, and ethical practice of otolaryngology, head and neck surgery, through education, research, and lifelong learning.
So the mission is really enabling otolaryngologists to provide the best possible patient care. And that is through with education, with research, providing them with the necessary tools that they need, the necessary background for lifelong education.
Since I was a resident, the Academy has been the main source of education and research for us, and has also helped us tremendously in the areas of socioeconomic, legislative advocacy, and humanitarian relief.
In 1896, Hal Foster founded the Academy, a move that forever changed the specialty. What we are doing now in areas such as specialty unity, research and quality, education, and advocacy is guiding the course that we will take as a specialty for the next century. Recently, we have begun undergoing an exciting transformation that will allow us to meet the challenges ahead. After years of planning, the Academy and Foundation Boards of Directors convened a specialty summit whose dynamic agenda fueled an open dialogue. The results of this summit have set the stage for more collaborative relationships.
The vision of the future is that our specialty needs to remain unified with the subspecialties under the Academy umbrella continue to develop and thrive in areas of research, education, and advocacy.
Together, we will be able to secure the future for the next generation of otolaryngologist head and neck surgeons. There has never been a time when basic otolaryngic clinical practice has been more relevant or better supported by our research activities. Our members are positioned as leaders in research to improve the quality of patient care and patient safety.
The Foundation really serves as a template, a palette for many of our young residents and young faculty to be introduced to the knowledge base of otolaryngology and where there are gaps in that knowledge base.
The Foundation's first-rate educational initiatives for its members are aimed at improving patient outcomes. Member volunteer educational committees are organized along clinical lines to increase production of content that is relevant to members' needs.
Researching and learning about how to care better for our patients is meaningless if we don't educate our members appropriately.
Academy U, our online learning platform, is giving members access to advances in education, anytime, anywhere, while providing a source for the Academy's intellectual property.
So if I'm in my office, I can jump into the computer, go to the Academy website, I can look something up, and I can get some great information on a disease process that maybe I haven't seen in a few years, or a decade.
The AAOH-NSF annual meeting and Oto Expo continues to be the world's largest and most respected gathering of otolaryngologists. The Academy believes that advocacy is the key to influencing future patient care and defining otolaryngology-related policies. The Academy spent the last year successfully addressing health policy issues, monitoring and influencing state legislation, and working to prevent a cut to Medicare payments.
It was only with the effort of the surgical societies and some of the smaller specialty societies like ours that we were able to achieve the critical mass necessary for those bills to pass.
The Academy has made it a priority to conduct a thorough evaluation of current relationships with corporate supporters to determine the best ways of partnering with them.
In an environment where there's increasing public and government scrutiny of corporate relations with medical societies and physicians, we have maintained the highest ethical and moral standards in partnering with people who wish to share our desire to improve physician education, to benefit our patients, and to ensure that we're providing the best medical care that we can.
We are laying the groundwork to embark on the Foundation's first endowment campaign that will provide necessary funds to secure the future of the specialty.
We need to develop an endowment so that down the road, regardless of what the economic times do, we will not have to adjust our agenda on behalf of our doctors and their patients because of changes in the macro or the microeconomy.
The most outward, visible representation of this change is in our new look, giving us an opportunity to help address the public's understanding of quality ear, nose, throat, head, and neck care.
We've moved into a new building. The new building isn't just more space and a new place for us to work. It actually has allowed us to redesign what we do to be more effective and more efficient. And all of these changes are reflective of the directions that we're going and the positive results that we know we're going to see in the next 10 to 20 years.
The Academy is looking ahead, actively working to empower our members to provide the best possible patient care, providing them the tools they need to succeed, and safeguarding the future of the specialty.
We are the resource for our members for everything that they need to practice medicine. And it's all reflected in our vision. Our vision is to empower all otolaryngologists to provide the best ear, nose, and throat and head and neck care possible. And that's what this change is all about.